Dear colleagues, welcome to the OncoAlert Cancer Weekly Roundup. Just out in Kidney Cancer Journal, systematic review of 12 hereditary kidney cancer syndromes correlated to histologies plus aberrant pathways. Very important as the discussion of germline testing in kidney cancer continues. Out on JCO Precision Oncology, tumor mutational burden is a predictor of first-line immune checkpoint inhibitor versus carboplatin benefits in cisplatin unfit patients with urothelial carcinoma. TMB of equal or greater than 10 have more favorable outcomes on first-line single-agent immune checkpoint inhibitors than carboplatin. TMB appears to be a promising biomarker to predict OS-PFS with IO in cis-ineligible metastatic urothelial carcinoma. With GI cancers accounting for almost 20% of all cancers in the US, a very timely JCO special series just out on precision medicine and immunotherapy in GI malignancies. An amazing resource for the GI community as the management of these cancers is multidisciplinary, it is of dire importance that we are all updated on what's going on. Great results of downsizing with chemo for early-stage rectal cancer. Results of CO28 trial suggest that induction chemo followed by minimally invasive surgery may offer a much-desired organ-sparing option for patients with early-stage rectal cancer. Out in Nature Medicine, ctDNA guide to re-challenge with panitumumab in colon cancer. Immune microenvironment profiling of breast cancer metastasis sees increase in M2 macrophages in brain metastasis, worsen prognosis in HER2 disease. Gilead Sciences announced a statistically significant OS from the phase 3 TROPiCS-02. Sacituzumab govitecan antibody drug conjugate prolongs OS in heavily pretreated patients with hormone receptor positive, HER2 negative metastatic breast cancer. Median PFS differences wasn't only 1.5 months. How are biomarkers influencing patient advocacy? Don't miss Jill Feldman as she addresses this question on the AACR Patient Advocate Forum, August 23rd. Finishing up with results from the ASCO plenary, landscapes of pathogenic germline variants in patients with lung cancer. This study found that about 7 patients with lung cancer harbored a pathogenic germline mutation, suggesting germline testing should be considered, along with the exploration of targeted therapies. There you have it, folks, this week's roundup. We'll see y'all next week.